because your audience is young children, ages 2 to 6, it's really, I think, kind of challenging to diagnose kids that young with ADHD. Now, some parents have been able to do that. They see that their kids are, the kids they see and their kids report, it's like kind of running on a motor all the time, like the engine is always revved up and going somewhere. But many kids are not diagnosed with ADHD until they go to school for a child, because when children have challenges with ADHD, they struggle to kind of push themselves through things that are harder for them, or they're just not, they don't know how to do yet. We also see in young children quite a bit of what I call this hyperactivity impulsivity. And this is why boys are often diagnosed earlier than girls, because girls more often than boys have inattentive ADHD, which doesn't show up until the later years, more around 12, 13, 14. So when kids often are going to school now and having to be more responsible for a lot of things, changing classes, harder academics, we start to see a diagnosis in girls. But for very young children, I mean, when we see a young child, we want to consider, are they struggling with communicating to other kids? Do they know the rules of the game, but they don't really pay attention to them, or they can't follow them? We see sometimes kids with ADHD missing social cues, slowing down to talk about, what they're feeling. They're just moving through stuff very quickly. And we may see, in some situations, kids who are kind of dreamy and slow processing. They're going at their own. They've got their own clock internally, and that's something that we want to look for as well.